Hi everyone. In this clip, I will talk a little bit about some important aspects of DMSO that I feel it's needed to be included. It was actually needed to be included in the first clip that I did. But just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. Now, so this clip is mainly for those who listened to the first one on the subject of DMSO and are choosing to try it. As beautiful as DMSO is and as widely useful and healing as it is also very powerful and potent. I felt like the clip is not complete without me adding a few pointers after having a chat with a dear friend of mine. DMSO is a small molecule, only a little bit larger than a water molecule, and it's made up of carbon, hydrogen, sulfur, and oxygen atoms. It is unique because it can attach to water-soluble molecules as well as oil-soluble molecules. So it can easily move through the plants, human, and animal skin membranes and exchange sites with bound water molecules. DMSO has transdermal qualities, which means it is able to pass through the skin and into the tissues below it and into the bloodstream, and it passes through the blood-brain barrier, which makes it exceptionally useful when dealing with stroke, head injuries, brain cancer, or any other brain issues. Because of its unique chemistry, DMSO has extremely wide range of uses and applications, but there are some points that need to be kept in mind. First of all, just like any other substance, overuse is definitely not recommended. More is not necessarily better, and also healing crisis can happen, which is normal. Many people have congested liver and kidneys, and they use DMSO. And when they do that, they will experience detoxification symptoms like headaches, nausea, mood changes, diarrhea, fatigue, or even hives and itching and histamine type of reactions. But these are, as I mentioned, healing crises and are not adding to the underlying issue, but getting rid of them, unlike chemical treatments, of course. One thing that I want to emphasize is that DMSO will enhance the results of anything that you take in combination with it, whether it is vitamin or medications. For example, compare taking the pharmaceutical drug metformin for type 2 diabetes while detoxing the pancreas and liver. Metformin damages these organs, but detoxing helps repair them. These are conflicting and incompatible sort of actions. DMSO allows anything you're eating, drinking, or taking greater access to inside of your body. So I'm also going to talk about few things that I think you need to be absolutely aware of, and I encourage you to do a whole lot more investigations. Always start with a small amount of DMSO and patch test yourself to see any reactions, and if there are any redness or itching or burning, chances are that you have applied a high concentration, and you can use aloe vera. Aloe vera is your friend to heal. Now, if you're using castor oil and DMSO combo, clean the skin and apply a layer of castor oil, then pat on 90% DMSO on top of a solution over it, and let it stay for about 20 minutes. Then wash the area thoroughly with baking soda and water. If you're applying it topically to get rid of, let's say, pain, apply it to a wider area than where the pain is for better absorption and better healing process. If you have any mercury dental fillings, do not use DMSO mixture for mouthwash. If you have done cataract surgery and you have a lens installed, do not use DMSO eyedroppers as it will cloud up the new lens. DMSO should not be taken internally with any diuretics, as it is a diuretic on its own, and any medication that alters kidney function should not be paired with DMSO. When you're applying any DMSO combination to the surface of the skin, we would need to sort of ensure that the skin is completely clean. Remember, one of the skin's functions is elimination, and at any given time, your body is eliminating and getting rid of toxins through it. If the DMSO combination is applied to a skin that was not cleaned, any toxins on the surface of the skin will be reabsorbed into the body. Do not wear clothing over the freshly treated area on your skin, as it will take the dyes from the clothing and deposit it into the skin. Wait about 20 minutes before getting dressed and make sure that you wipe off any leftover. When using DMSO, do not wear synthetic fragrances, body lotions, aftershaves, etc., as well as the popular synthetic fragrances now being used in outlets and more. Remember, your goal is to heal yourself, and poisoning yourself with synthetic scents will not be helpful. You can, however, use natural essential oils if you wish. Also, if there are any tattoos on the body, DMSO should not be applied on them or on that area, as the chemicals in the ink will be pulled into the bloodstream. When topically applying DMSO creams or lotions, make sure you're not wearing any jewelry that touches them, that touches the DMSO. DMSO acts as a binder to take metals out of your body, and in this case, coming into contact with it will carry it into your bloodstream. When creating or taking DMSO combinations, the only type of equipment you need to use, it needs to be glass and nothing else, as it will actually take particles from any other material with it into your body. I always use glass measuring cup, glass funnel, glass pipettes, etc. And everything needs to be absolutely sterilized. And I usually boil them for a few minutes in hot water before using them, and ensure that everything I work with is properly cleaned and sanitized with 99% alcohol, especially if you're making any combinations for the eyes or the ears. Do not use regular plastic or metal measuring spoons or utensils. Never use gloves if you're applying it on yourself or someone else. Ensure that the hands and the area are clean, and if you must, you can use a clean cotton swab to apply it. Avoid alcohol and smoking if you're taking oral DMSO, as the actions are basically counterintuitive. DMSO can open the skin barrier to many things, so make sure you do your treatments well ahead of any gardening, building, painting, and so on. If you have silicone implants, you may want to stay with very small doses and far away from the implant site as possible. And if you have had Botox treatments, DMSO will clear the effects of it. But if you're actively taking Botox treatment, then stay away from DMSO. DMSO is light sensitive, so keep it in an airtight, dark glass container in a cool area, and don't put it next to iodine, as it can take the yellow color into itself. If you're taking it internally, taking it in combination with MSM supplement will eliminate the garlic and oyster breath effect that it may have afterwards. In your DMSO combinations, always use distilled water. And if you're taking DMSO internally on a daily basis, make sure you have a period of break. Perhaps don't use it over the weekends. Proper measurements and dosages matter, so please measure carefully. DMSO combinations with vitamins are used in hundreds of treatments for human and animals. Please thoroughly research the subject. Hope this has been helpful. Like and follow for more. Be the light.